This is the Healthcare Marketplace Specialization, Healthcare Marketplace Overview. My name is Steve Parenti, and this is Module 5.3.5, Final Summary and Next Steps. And this really is concluding all the skills that really allow one to do a market valuation. So we've talked about intellectual property, we've talked about regulatory affairs, but we need to get this technology paid. And so fortunately, there are codes, otherwise known as diagnosis-related groups, that are used by Medicare to pay for inpatient events. And inside those DRGs are two of them, 306 and 307, cardiac congenital valvular disruptions, with major complications and comorbidities. And then the same idea here with major complications without those pieces. Those would all be possible for reimbursement. Also, if we look at ICD codes that are already in place for Medicare, we see that there's a set of other codes that would make sense for reimbursement in different technologies. So how to price it? This is another challenge. The pricing in the U.S. is going to be about $7,500. Overseas, which is our U.S., will be about $4,000, with an average price point about $5,700. The expectation is that after 6 years, there'll be erosion from $7,500 to $6,500, $4,000 to $3,500, with an average price long run of about $5,000. If we're doing evaluation technology, we have to look at what the discount rate is. The more volatile it is, the higher the discount rate is for financing. So seed rounds, friends and family and things like that, could be as high as 80%. First stage would be at 40-60%. If we go for public financing, it might be a lot less than that. We're basically going to put in a 47% rate, figuring that this is really a first stage investment since the seed money has already come and gone. And the thought is it'll be reducing by 2% annually. Now, if we put this all together, we can actually do it sort of three different valuations. One is conservative, the other one is nominal, really the middle of the road, and then a very aggressive launch in terms of what we expect market share to be. So, for example, here, 5% market share and growth of 1%. Nominal, we're saying it's going to be about 10% market share. 2% aggressive means we're going to go even faster than that. So if we go with nominal, what we actually find is that, roughly $500 million is the net present value coming back from this technology. It could be really huge, and granted much bigger for aggressive, but just staying middle of the road for a second here, it's positive, and that's a really, really strong sign for technologies. Most valuations that we do not typically have this good financial portfolio. So for conclusions for this valuation, the IP landscape shows other firms pursuing treatment, but there's not an obvious infringement with other patents. They're going to need to continue to get their own IP protection and make sure that they have the right IP generation. They should consider outsourcing other partners because it's going to be a major problem to get this thing to market quickly. They need to get their PMA application in place. They have a favorable reimbursement pathway. The threat of new entrants and user adoption could be an issue, but they could stay in the front of the industry for a while. There's a growing population warrants further development in clinical trials, knowing more about the population, penetration, and market share. And the good news is that their net present value is so good, it might be able to be leveraged for future financing to go forward. Not always the case. Many times not the case when we do these types of technologies. But at the end of the day, all these elements need to be in place and known to understand what to do next for a technology. So in summary, we've really checked off, do we know if the physicians and patients like this? Most likely, because it'll be effective. We know it's feasible and defensible. It has a good reimbursement scenario. The market estimates look great. The clinical data looks reasonable, but we need more human trials. Information, good possibility of growth. Payback is favorable. Could really disrupt the market. And so in the end, we say investment is recommended. And as folks go into looking at their capstone projects, they should consider using this exact same template, thinking about a new technology or service innovation to really know who the audience are and the landscape partners and see whether or not they are willing to go along with this technology. This concludes this module on looking at evaluating new medical technology, and it also concludes all of the modules that go along with the healthcare marketplace overview course.